Panic disorder is a type of anxiety disorder characterized by unexpected and repeated episodes of intense fear, often accompanied by physical symptoms such as chest pain, heart palpitations, shortness of breath, dizziness, or abdominal distress. Understanding how doctors diagnose panic disorder is essential for anyone experiencing these symptoms or supporting someone who is. In this video, we'll walk through the step-by-step process that healthcare professionals use to identify and confirm panic disorder, ensuring that patients receive the right care and support. Let's begin by exploring why a thorough diagnosis is so important. Accurate diagnosis of panic disorder is crucial because its symptoms can mimic those of other medical conditions, such as heart disease or thyroid problems. Misdiagnosis can lead to unnecessary treatments or missed opportunities for effective therapy. Doctors use a systematic approach to rule out other causes and confirm panic disorder, ensuring that patients receive the most appropriate interventions. This careful process helps prevent confusion and provides clarity for both patients and their families. The diagnostic journey begins with an initial consultation. During this visit, the doctor will ask the patient to describe their symptoms in detail, including when they started, how often they occur, and what triggers them. The doctor will also inquire about the patient's medical history, family history of mental health conditions, and any recent life changes or stressors. This conversation helps the doctor gather essential background information and begin forming a clinical impression. Next, the doctor conducts a thorough assessment of the patient's symptoms. This involves asking specific questions about the nature, frequency, and duration of panic attacks. The doctor will want to know if the attacks are unexpected, how long they last, and what physical and emotional symptoms are present. This step helps distinguish panic disorder from other anxiety disorders or medical conditions with similar presentations. A physical examination is an important part of the diagnostic process. The doctor will check vital signs, such as heart rate and blood pressure, and look for any physical signs that could indicate another medical condition. This step helps rule out physical illnesses that might be causing the symptoms, such as cardiovascular or endocrine disorders. If necessary, the doctor may refer the patient for additional medical tests. To further exclude other medical causes, doctors may order laboratory tests. Common tests include blood tests to check thyroid function, blood sugar levels, and other markers that could explain the symptoms. These tests are not used to diagnose panic disorder directly, but are essential for ruling out conditions like hyperthyroidism or hypoglycemia, which can present with similar symptoms. A psychological evaluation is a key component of diagnosing panic disorder. The doctor or a mental health professional will use structured interviews or questionnaires to assess the patient's mental health. These tools help identify patterns of anxiety, avoidance behaviors, and the impact of symptoms on daily life. The evaluation also screens for other mental health conditions that may coexist with panic disorder, such as depression or other anxiety disorders. Doctors use established diagnostic criteria, such as those in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, to confirm panic disorder. The criteria include experiencing recurrent, unexpected panic attacks, and persistent concern about having more attacks or changing behavior to avoid them. The doctor will carefully compare the patient's symptoms to these criteria to ensure an accurate diagnosis. An important step is to rule out other mental health disorders that might explain the symptoms. The doctor will consider conditions such as generalized anxiety disorder, social anxiety disorder, or specific phobias. This process involves comparing the patient's symptoms to the diagnostic criteria for these other disorders and ensuring that panic disorder is the best fit. Doctors assess how long the symptoms have been present and how much they interfere with the patient's daily life. Panic disorder is typically diagnosed when panic attacks and related anxiety persist for at least 1 month and cause significant distress or impairment in social, occupational, or other important areas of functioning. The doctor will ask the patient to describe a typical panic attack in detail. This includes the onset, peak, and resolution of symptoms, as well as any physical sensations, thoughts, or fears experienced during the episode. This information helps the doctor understand the patient's experience and differentiate panic attacks from other types of anxiety or medical events. Family history can provide important clues in diagnosing panic disorder. The doctor will ask if any close relatives have experienced similar symptoms or have been diagnosed with anxiety or mood disorders. A positive family history may increase the likelihood of panic disorder and help guide treatment decisions. Doctors will inquire about the patient's use of substances such as caffeine, alcohol, nicotine, and recreational drugs. Some substances can trigger or worsen panic attacks, while withdrawal from certain substances can also cause similar symptoms. Understanding substance use patterns helps the doctor make an accurate diagnosis and recommend appropriate interventions. A review of current and recent medications is essential. Some prescription or over-the-counter drugs can cause side effects that mimic panic attacks. The doctor will carefully review all medications to rule out drug-induced symptoms and ensure that panic disorder is not being confused with a medication reaction. Doctors screen for medical conditions that can present with panic-like symptoms, such as heart arrhythmias, asthma, or thyroid disorders. This may involve additional tests or referrals to specialists. Ruling out these conditions is vital to avoid misdiagnosis and to provide the right treatment for the patient's actual health issue. Doctors may use standardized screening tools or questionnaires, such as the Panic Disorder Severity Scale, PDSS, to quantify the severity and frequency of symptoms. These tools help track progress over time and provide a structured way to assess the impact of panic disorder on the patient's life. Doctors observe whether the patient is avoiding certain places, situations, or activities due to fear of having a panic attack. Avoidance behaviors are common in panic disorder and can significantly impact quality of life. Identifying these patterns helps tailor treatment strategies to address both the panic attacks and the resulting avoidance. Assessing functional impairment is a key part of the diagnostic process. The doctor will ask how panic attacks affect the patient's work, school, relationships, and social activities. Significant impairment in these areas supports a diagnosis of panic disorder and highlights the need for intervention. Doctors will ask about any previous treatments for anxiety or panic symptoms, including therapy, medications, or alternative approaches. Understanding what has or hasn't worked in the past helps guide future treatment recommendations and avoids repeating ineffective strategies. It's common for people with panic disorder to have other mental health conditions, such as depression or substance use disorders. The doctor will assess for these comorbidities as they can influence the course of panic disorder and affect treatment choices. Differential diagnosis is the process of distinguishing panic disorder from other conditions with similar symptoms. The doctor will systematically consider and rule out other possibilities, such as cardiac arrhythmias, seizure disorders, or other anxiety disorders, to ensure the most accurate diagnosis. Structured diagnostic interviews, such as the MINI or SCID, may be used to systematically assess for panic disorder and other psychiatric conditions. These interviews follow a standardized format and help ensure that all relevant symptoms and criteria are thoroughly evaluated. Doctors may ask patients to keep a diary or log of their panic attacks, noting the time, place, symptoms, and possible triggers. Self-monitoring provides valuable information about patterns and helps both the patient and doctor understand the disorder more clearly. Doctors assess for any immediate safety risks, such as suicidal thoughts or behaviors, which can sometimes accompany severe anxiety or panic disorder. Addressing safety is always a top priority, and appropriate interventions are put in place if any risks are identified. Diagnosing panic disorder may involve collaboration with other healthcare professionals, such as psychiatrists, psychologists, or primary care physicians. Teamwork ensures a comprehensive evaluation and allows for input from different perspectives, leading to a more accurate diagnosis. Educating the patient about panic disorder is an important part of the diagnostic process. Doctors explain the nature of the condition, its symptoms, and the reasons for each step in the evaluation. This helps reduce anxiety about the process and empowers patients to participate actively in their care. Once all information has been gathered and analyzed, the doctor discusses the diagnosis with the patient. This conversation includes an explanation of the findings, the reasoning behind the diagnosis, and an opportunity for the patient to ask questions or express concerns. Shared decision-making is encouraged throughout the diagnostic process. The doctor and patient work together to decide on next steps, whether that means starting treatment, seeking a second opinion, or monitoring symptoms further. This collaborative approach respects the patient's preferences and values. Proper documentation is essential. The doctor records the diagnosis, supporting evidence, and any relevant findings in the patient's medical record. This ensures continuity of care and provides a clear reference for future healthcare providers. Cultural background can influence how panic disorder symptoms are experienced and expressed. Doctors consider cultural factors during diagnosis to avoid misunderstandings and to provide care that is sensitive to the patient's unique context. Diagnosis is not always a one-time event. Doctors may reassess the patient's symptoms over time, especially if new symptoms develop or if the initial diagnosis is uncertain. Ongoing evaluation helps ensure that the diagnosis remains accurate and that treatment stays on track. With the patient's permission, doctors may involve family members or close friends in the diagnostic process. Loved ones can provide additional information about symptoms and offer support throughout diagnosis and treatment. Technology can aid in the diagnostic process. Telemedicine, Electronic health records and digital symptom trackers allow doctors to gather and review information efficiently, especially when in-person visits are not possible. Doctors pay special attention when diagnosing panic disorder in children, older adults, or pregnant women, as symptoms may present differently. Tailoring the diagnostic approach ensures that these populations receive appropriate care. Stigma can be a barrier to diagnosis and treatment. Doctors address concerns about stigma by providing reassurance, normalizing the experience of panic disorder, and encouraging open communication. This helps patients feel more comfortable seeking help. Doctors provide patients with resources such as educational materials, support group information, or referrals to mental health specialists. Access to resources empowers patients to learn more about their condition and seek additional support as needed. Follow-up appointments are scheduled to monitor progress, reassess symptoms, and adjust the treatment plan as needed. Regular follow-up ensures that the patient continues to receive appropriate care and support throughout their recovery journey. Doctors encourage patients to advocate for themselves by asking questions, expressing concerns, and participating actively in their care. Self-advocacy leads to better outcomes and helps patients feel more in control of their health. Doctors work with patients to identify and address barriers to care, such as financial concerns, transportation issues, or lack of access to mental health services. Overcoming these barriers is essential for successful diagnosis and treatment. The diagnostic process is closely integrated with treatment planning. Once panic disorder is diagnosed, the doctor works with the patient to develop a personalized treatment plan, which may include therapy, medication, or lifestyle changes. Doctors continue to monitor for any changes in symptoms or new developments that may affect the diagnosis. Ongoing monitoring ensures that the patient's care remains responsive and effective over time. Progress is documented at each follow-up visit, including changes in symptoms, response to treatment, and any new concerns. This ongoing record helps guide future care and ensures that the patient's needs are consistently met. If the patient's symptoms change significantly or new symptoms appear, the doctor will reevaluate the diagnosis. This may involve repeating some of the earlier steps to ensure that the diagnosis remains accurate and that the treatment plan is still appropriate. Long-term support is often necessary for people with panic disorder. Doctors provide ongoing care, monitor for relapses, and help patients develop coping strategies to manage their symptoms and maintain their well-being. Diagnosing panic disorder is a careful, step-by-step process that involves gathering detailed information, ruling out other conditions, and using standardized criteria. Collaboration between doctor and patient is essential, and ongoing monitoring ensures that care remains effective. If you or someone you know is experiencing symptoms of panic disorder, seeking professional help is the first step toward understanding and managing the condition. Remember, with the right support and treatment, recovery is possible.